Hi, my name is Dr. Allison, and I am a doula, childbirth educator, and breastfeeding educator. And today I'm going to be talking about how to breathe during labor and during pushing. Okay, so let's say you're in a hospital setting. You're in a hospital setting. Typically, what happens is your medical team, your physician, they have you lay down on your back. Your legs are up in stirrups and your knees are pulled back. They tell you to take a big deep breath in, hold it, and bear down while you push with that contraction to push your baby out. That's typically what I hear happens and what I've seen happens. But that's not the preferred way to push or breathe during labor and the pushing stage, because what that is going to do is going to limit the oxygen to your tissues and to your baby and to yourself. When you hold your breath like that, that also increases the risk of tearing and damage to your pelvic floor, and it just makes pushing a little bit harder. So I'm going to show you some ways that you can breathe today that will help with getting baby out, optimizing oxygen, and reducing risk to your pelvic floor. So first of all, instead of pushing or laboring on your back, there are many ways to labor. So many different positions, whether that's side lying, whether that's standing, squatting, sitting on all fours, standing and rocking back and forth, laboring on the birth ball or the toilet or in the water. There's so many different positions that you can labor in. That's going to be more optimal for using gravity to bring your baby down. So when you are in active labor, when you are in transition, try to use those different positions, because that's going to also help with your breath versus when you're laying down on your back and you're having this weight on you, limiting, expansion of your ribs and of your back and of your rib cage. So laboring in those different positions already is helping with gravity bringing your baby down, and oxygen, and for breathing. So when you're in active labor, when you're in transition phase, the way that you can try to breathe is that in through your nose and out through your mouth. Of course, it's going to be quicker than that when you're in that more intense contractions. So early labor, it might look like in through your nose, out through your mouth. It might be that slow, but when it gets to active labor, it might be a little bit quicker, like. But I encourage you to get a full breath versus shorter breaths of and holding your breath in. So try to breathe in and breathe out. Fill your body with air, and exhale, breathe that out. So when you fill with air, you want to feel your entire rib cage expand, your back expand, belly expand with air. And when you exhale, you want to feel things come back together. That's kind of the bare bones of deep breathing. And through those contractions in active labor, you can think of your happy place. You can pick a focal point to breathe. Working on your breath helps you to stay focused during when those contractions are getting really intense. And when it comes time to pushing, I encourage you to push in whatever position feels comfortable to you. Normally, women are not as comfortable laying on their back, but if it happens to be comfortable for you, by all means, labor on your back. But if it's not comfortable, choose a different position. Your position should not be dependent on whatever your physician is saying or wants you to do. It should be comfortable for you. This is your birth. This is what's happening to your body. Pick a position that's going to be very comfortable for you to endure that pushing stage and those contractions at that time. So choosing one of the above that we said, side lying. If you're able to get out of the bed, if you don't have an epidural, you can be squatting, you could be on all fours, things like that. So when it comes time to pushing, instead of breathing in and holding your breath and then trying to push, you see how my neck was tightened, my jaw was tightened, I was more tense. That's not the optimal position or feeling that you want when you're trying to bring a baby out. Because if everything up here is tense, baby's not going to be able to move down as quickly. As you saw, I'm holding my breath, and as I'm doing that, then oxygen is not being flowed to the different muscles and to the baby that they need to get out. So what I instead say that women should do for their breath is called a J breath. So you want to focus your energy in and down through your abdomen to the baby and out through your vagina. So a J. So you want to breathe in that motion. So same as before, you're going to want to breathe in, but focus your mind and your energy down and out. So you want to focus your mind and energy with that breath, with the contraction, timed with the contraction, and you also want to give a push with that. So how are we going to switch this from the breathing from before to breathing your baby out? So some people call it like a moo breath, but that makes me think of a cow, and it makes me feel like a cow, and I'm not a cow. So I just call it an ooh breath. Just take that M off and call it an ooh breath. So instead of a moo, it would just be ooh. That's just my preference. You can moo if you want. So we're going to breathe in and ooh. As you hear that low sound, ooh, it relaxes your jaw. You're still breathing out, and that ooh, that sound helps focus that energy and focus your breath downwards. And you can feel it, even if you're not pregnant or having contractions at the moment. You can feel it as you breathe in. So you can try this with me. Breathe in. Ooh. And you can still focus it into a J, but that ooh, and as you feel the urge to push and it's time to push, you can also give a push with that, with the moo, with the ooh breath, and with the contraction as well. So with that, that should be able to help you reduce the tearing, reduce the extra pressure on your pelvic floor and extra force by focusing on your breath and focusing on the correct pushing timed with the contraction. So that should help a little bit, or a lot of it. And as always, do what's best for you in your birth, whatever you feel like is right. If your body is telling you to do something different, by all means, do that. And yeah, so try practicing the ooh breath. Try practicing as you sit on the toilet to try to have a bowel movement. Practice it then. That's one of my big techniques that I give to my mamas. Practice that then while you're sitting there, and see how it feels to ooh with a bowel movement. It's a good way to practice. You might be laughing, but it is a good way to practice. So try those, try the breathing, and I hope this helps for your labor. Okay, thanks for watching today, and happy pushing. Bye, take care.